Alright, so friends, it's Harrison here and welcome back to my channel. So you're probably wondering why I'm topless. You're actually probably not wondering because you can read the title and obviously this is a top surgery update. But anyways, so yeah, I am 1 year post-op. So I'm gonna look back. I can't remember when my last update was. I think it was probably like 6 months, honestly. I think for me, like, while you're updating with T, there's so many changes that you can update. With top surgery, there's only really like scarring that you can kind of gauge. Yes, mobility and everything like that, but that stuff just takes so long. Like, I'm a year post-op and I'm still waiting for things to heal on my scarring and stuff like that. Like, I feel like around my 8-month mark was when I really started to feel very liberated in my body motion. Like, I could start to do like pull-ups without feeling like a pull. And then like scarring, like the stretching wise, I'm not really nervous about the stretching anymore. I think it kind of settled into what it was going to be around 8 months. So everybody is different, every body is different. Just know that your results will not be the same as mine are not the same as yours. So that's just my little disclaimer. But yeah, so I've gotten back into working out. I'm really working on my chest. So for those of you who don't know, my ferret recently passed away, so I don't like to make excuses, but I kind of stopped, not eating, but I wasn't eating properly, and like I wasn't able to go to the gym as frequently because I was just sad. But I'm feeling better, I'm eating better, and I'm getting back into my routine, so feeling pretty good about it. Like, it's nice to see this definition and to be able to feel like the right kind of cleavage, I guess. But yeah, so this is what it looks like. I feel really good. I love, like, I got mine done with Dr. Garramone in Fort Lauderdale, Florida. The nipple placement is amazing. The scarring is in a great spot too. Like, I feel like once I'm able to build my pecs, they'll grow right above the scar line, so I think it'll look really nice. So yeah, I'm gonna show you all up close. Okay, so this is what it looks like up close. So this side is the worst side. It's interesting. I just have these like rough scars. Like, these are, it's like actually like rough to the touch. And it's a similar kind of feeling for my nipple, but yeah, like, I don't know why this is so dark and it's not really getting any lighter. I think it's gotten a little bit lighter around here, and there's obviously some spots where it's gone completely white, that's really smooth right there. Like, I'm hoping that this will start to spread. Like, here is great too, because the incision starts here. You can't really see it until about here. So I do have like some white spots. I think I have another one right about there somewhere. And here it's very, very smooth. I just don't know why it's like that. Like, I'm trying to moisturize it. I'll show you what I use. All right, so this is what I've been using. I've been using this like Mederma quick dry oil. I was using bio oil for a while, but I ran out of the bottle, and this was at Walmart, so I just picked it up, and then I'll rub it onto my my scarring. I'm gonna put it on now. I already put it on this morning, but why not? Can't hurt. But yeah, I rub this on. I do that for like a couple minutes each scar, and I feel like, I don't know, like, it's hard to really like tell like if stuff is like working. Like, when you put something on for like the first month, you're like, oh my gosh, it's not working, and then you try something else like month 3, you're like, oh my gosh, it's working so much better. I don't really think that it's the product. Like, obviously product helps, and it's gonna be better than doing nothing for your scars, but I feel like the stuff that works the best is time. Sorry, it's a little awkward. But yeah, so I feel like the stuff that works the best is time. And the more time that you give to your scars, the better that they're going to be. I feel weird not doing it on this side, so I'll do a little quick. But this side is a lot better, but don't know why. But this side gives me hope for my other side to kind of clear up a bit. And then also for, before I get into this side, for my nipples, I've been using like Nivea, like just a moisturizer, because it gets like hard. Like, it gets like, not hard, it just feels sometimes itchy and dry, which is kind of annoying, because I kind of wish that, I'm not sure how many guys like moisturize their nipples in the morning, or cis guys moisturize their nipples in the morning, so it kind of makes me feel like it's an added reminder that I'm trans, Mind you, it's not terrible if like dry nipples is the only thing that I have to deal with. I had a really great recovery, and I know that I'm very fortunate to have this surgery, so I'm not complaining. I love this surgery, but I'm just being open with you all that it's kind of annoying to have to moisturize my nipples. So yeah, so let's go on to the next side. All right, so as you can see, like this incision starts here, and it doesn't really show up till about here. Like it's completely white and it's very smooth. It blends in with my skin really nicely. Like I think if you were to like see me, if I was just covering this side, you really can't see this scarring. But yeah, like it just feels really, really nice, and it gives me hope for the rest of this. Like here, again, it's nice and soft and white there. But again, I have the bumpiness and like the little bit of itchy stuff going on right now, but it's getting a lot better. And I would like to say that like Mederma is what's made my skin. No, I think it's just time, giving myself time, making sure that I take care of it. And yeah, so that's what it looks like right now. I'm feeling really good about it. It's just annoying there. But yeah, so hopefully that goes down and it starts to look all uniform like this. That's pretty much like all the updates that I have. I just wanted to show you all kind of what it looks like and talk about the scarring. So in terms of the scarring, so there are things that you can do to reduce this. Like obviously there are the stuff that you can get over the counter, like ScarGuard, Mederma, bio oil, whatever. There are those types of treatments. They range in different prices. There's also like surgical things that you can do to help scarring, which sounds a little interesting. But I am exploring the idea because this has been really, really red, and it's something that like I'm not self-conscious about, but I really do wish that I could just take my shirt off and everything would look like this. Like I think that this looks absolutely amazing, and I would love to have my scars look like that. I'm not ashamed of my scars. I just wish they weren't so red. You can do these at surgical places, and you can do these at some spas and some places that do facials. So there's different types of things that you can do with like laser. So I am considering maybe getting some lasering done on this side, maybe even here. I just kind of want to give this a little bit more time because like every month it gets a little bit better. Like I can't believe how much this side has really come along, and that's been time. So if you're like, oh, what's the magic treatment? What's this magic cream that I can use to make my scars like look like nothing? Time. But yeah, so that being said, like I'm like, oh, okay, well, time, you have to wait. I'm getting a little bit impatient, so I'm gonna see what I can do with this. So I'll keep you all posted on that. I may get a consultation in a little bit. Like I do have a little bit of acne scarring as well. So that's what I was initially talking to with these people, like estheticians, I think maybe that's what they're called. I can't remember, but I was talking to them about getting rid of some of the pigment that I have like on my cheeks, and they're like, and I said, hey, I've had top surgery and I have these scars on my chest. Would a similar process be applicable to that? And they're like, yeah, absolutely, we do these on surgical scars as well. So they took a look at it and they're like, oh yeah, no, we could totally help you out with that. So I don't know if it's just them blowing smoke up my, you know where, but I'm going to price that out and see what that does. So I'll keep you all posted on that. Maybe that'll be the next update, is maybe what LASIK looks on your scars. But yeah, so that's about it. If you have any questions, please put them in the comments. Also, anything to do with medical stuff, like being like, hey, like I'm bleeding, like what do I do? Or like, hey, my nipple fell off, what should I do? Don't put that in YouTube comments. Call your doctor. Anything that is alarming to you, that you are concerned about your health, go to your doctor. Don't go to me. But anything else, I will be happy to help you out with that. But yeah, so anyways, thank you all for watching and putting up with shirtless me again. But yeah, so anyways, I'll see you next time. Take care.